Hello, 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 and happy Saturday.
Hey, world.
Welcome to Ask the O Coach and Ask Beth the Chemo
The Beth, the
Nurse.
chemo nurse. We get tongue-tied when we say that. It's a lot of words. Sorry,
A
guys.
lot of words.
But I just want you to ask. I want you to send in questions.
Please
so that's
do.
the first part of my handle.
Please do. So, let's just start off with
This is Saturday afternoon.
Saturday afternoons.
Questions. We're going
Yes.
to talk about cancer and move your head so you can be in this. And you could be like, we're going to talk about sexual health because it's like a taboo subject. It's not talked about when we do our patient teaching very often, and it's something that we need to address. It's a big deal. And today I'm going to talk about sleep because a lot of my patients complain that they're not getting enough sleep. I have to actually ask them because they don't volunteer the information, but it's really critical that you get a good night's sleep, and we'll talk about that today.
And the O Coach is going to touch on vaginal dryness during and post chemo and during chemo. So that's what my topic's going to be about today. And please feel free, even keep the questions going even after the live. Now, let's explain this. When we do it on our Saturdays,
how can they send you questions? Where do they send it?
They can drop it in the comment box, and they can inbox us,
Right.
and we'll get back to you within 24 hours.
And I have a new email address. It's askthechemonursebeth@gmail.com. So you can email me questions because sometimes I go through my social media and I can't find the questions till like 5 days later, and I don't want to do that. If you have a question, I want you to be able to, ask me so I can give you answers.
Yes.
So we're going to be talking about all kinds of things related to cancer because that's our field,
Yes.
and how it affects sexual health, and we're going to have ongoing information to give to you guys to share with you. So hopefully this will help you, and share the station, share our situation, our
Like, share, and
yeah, definitely, whatever they call
subscribe.
that, like, share, and subscribe.
Like, share, and share. Share.
Yes.
Like, share, and share.
Sorry.
So, I am a certified sexual wellness coach, and Beth is a registered chemo nurse. So, who other to pair up with to talk about this topic, because this topic is like taboo
Right.
in the world of oncology and sexual wellness. So we need to bring it out to the
Hi,
forefront,
Stephanie.
and we need to get it popping because they suffer with vaginal dryness and need
devastating.
dilators.
Devastating.
And, who wants to go first? You or me?
You
want to talk about me?
So what do you do? Like, first of all, you've been in this field forever.
Yes,
How many
since
years?
2007.
A long
so
time.
over like 20 years.
Yeah. So yeah. So, what do you think is like pressing situation? What do you think is you want to talk about today?
So I wanted to speak on vaginal dryness and the dilators and the lubrication. The lubrication is extremely important because when you're going through radiation or taking the AI chemo drugs, it's important. And even if you're doing IV chemo.
What's AI?
AI is like the tamoxifen, the I can't even.
It's just shutting down your estrogen.
Yes,
So that's what's
yes.
shutting down your. That's what's making you dry.
Get it out.
You're in menopause. We
Yes.
put you into menopause because if your hormones are feeding that cancer, we want to shut those hormones down. But what that does to the vagina is like awful. It's awful vaginas.
Smear your head on over.
So what are we doing about dry vaginas?
The dry vaginas, the dryness is, oof, gosh. Let me start off with when you're doing radiation. It's tearing down the pelvic floor. It's tearing down the lining of the vagina, the vagina wall. So it's thinning out. So now you're feeling like you have a sunburn down there, and that really hurts if you've ever had sunburn. And sometimes you can get blisters and all types of things. You still want to keep your sexual drive going, and it's not comfortable.
Right.
So use the right lubrication. Now, I've spoken to nurse practitioners, breast navigators, and some doctors, and they said that, their patients are complaining about the vaginal dryness and using the KY jelly and using some of the using some of the lubrications that they offer. Now, I offer Just Like Me. Just Like Me is a lubrication that feels just like you. And
that's the name of the lubrication?
That's the name of
Who
the
makes
lubrication.
that?
It's with Pure Romance by Kimberly Newman. So
okay.
I'm based with, I'm a distributor with Pure Romance by Kimberly Newman.
Can we put the link here?
Yes, we'll put the link
there.
in.
Okay.
Yes, we'll put the link in there. And with the, let me show my face just a little bit. There we go. There we go. We're just trying to get it together. That's why we love live, because you can be live, you can be you, and we love you.
We're human. We're just trying to help you help people. That's it.
So with the vaginal dryness, when you're doing the radiation, then with that dryness, it's really irritating. It's extremely irritating, and you want to keep yourself lubricated. And with the Just Like Me, you don't walk around feeling like you just left the gynecologist's office. You definitely don't. It absorbs into the tissue walls. It's comfortable. It feels just like you. You're not walking around. You know women. We all been to the gynecologist, and if you haven't, you need to run to your gynecologist. But I even sell this to gynecologists in my local area within the Florham Park area.
Wasn't there something, you were just doing something with one of the local cancer centers? They were talking about, what were they talking about? The radiation and the...
They were discussing with the radiation and how the radiation really tears down the vagina.
But they're recommending this product.
Yes, they definitely.
It's on their education.
It's on their educational sheet. It's
facility.
Michigan, I think, is Argel. And they're out in Michigan. They're in Michigan, and they have vaginal rehabilitation therapy for their patients. And they also recommend our lubrication. So they reference back to it. And they also recommend our dilators as well. Now, let's talk about women that don't have cancer and maybe going through lupus, have high blood pressure. They too can use this lubrication.
Yeah, so tell people that this is out there. Mm-hmm. It's not even that expensive.
It's not. It's $20.
It's nothing.
It's $20 plus
make
tax.
A big difference. And we have younger and younger patients nowadays.
Yes.
Like, I will tell you, there was like such a change in my demographic that I treat now. Mm-hmm. And these people are coming in and they're going through treatment and they're having these side effects, and like it's devastating. They're losing their hair. They're changing. They're having maybe a mastectomy or something, and they're losing their feeling of feeling like a woman. And this puts that back in their hands.
Yes.
I feel like.
Yes. We want to feel fresh and vibrant down there, even though we are going through the situation that we're going through.
You're still you.
Yeah, you're still you. You're still you. You guys need to attend How to Get Your Sexy Back, my seminar that I'm hosting. I'm going to be hosting that April the 13th. But also the dilators. The dilators play a big part. You're out there, you still want to be intimate with your partner. You don't want to lose that intimacy part. And guess what? This helps out with intimacy so much that you'll thank me.
Nobody talks about this.
Nobody.
So this is important because we have to break the silence, because people are suffering.
They are suffering.
And they're not talking about, they're talking about their nausea, they're talking about all the other things. They're not talking about sex.
No, they're
and
not.
They're not talking about sleep.
They're not. They're not talking about
They don't tell you. You have to, how are you? I feel crappy. What's going on? I had diarrhea. They're not telling you they're not sleeping.
No, they're not.
They're just suffering in silence.
And you cannot suffer in silence. You need to speak out. We're big on women's health. Women's health has been silent and put on the back burner for years, decades. So, ladies, I'm out here. Beth's out here. That's why we say, ask the O coach today. Ask the chemo nurse, Beth.
Send us questions.
Send questions. Send this to your friend that is going through something, vaginal dryness, needs dilators. The dilators help stretch. The vibrator, the clitoral vibrator that I have called Make Waves, you insert it with some lubrication. You need that stimulation going in the vagina. Remember, our vagina and womb is our sacred spot. That's our motherboard. That's what we think, So I'm going to hand this over to Beth. If you want to reach out to me, remember, I'm on the OCoach_69. I'll go over here. Sorry.
Hey.
The _69. The OCoach_69. Follow me. Also, follow Beth at Ask the Chemo Nurse Beth, right? Did I
Yep,
say it
that's
right?
my Instagram. And then if you want to send me an email or you want to send me questions, you want me to look at something that you might have heard about, I'm happy to look at it. And you could send it to askthechemonursebeth@gmail.com.